So you see what we're talking about this afternoon, the title of my presentation? What I will tell you that this presentation, the level of it, because you are a mixed audience and you're not all dermatologists, it's going to really be at the general practitioner level when I talk about the challenges that we have for otitis externa. And then once we get into talking about Neptra itself with the studies that have been done, there'll be a lot of detail that we'll go into it at that point. So bear with me through the first portion of it when we talk about the challenges. Again, at the GP level, and that really actually makes sense because of the fact that you'll see this particular product is really aimed at first opinion veterinarians for use of the common cases they see on a day in and day out basis in their practice. So Donna talked about Claro. Show of hands, how many of you in the audience know about Claro, are familiar with Claro? Just raise your hands. So not very many. Well, Claro is exactly the same product as Neptra. That's the name of the product in Canada and in the United States. We have had it available for 4 years in the United States. It has a 44% market share. And to give you some perspective, there is no single otic product in the UK that has a 44% market share. And over the course of the last 4 years, 5 million doses have been dispensed in the United States. So we know a whole lot about it. So I'm going to get through this presentation. We're going to have a Q&A session at the end for about 15 minutes. And then obviously I'll be around for the rest of the day to answer any specific questions that you might have about this product. So that is the way we're going to do the afternoon. Now, first of all, just based upon definition, this is a product for otitis externa. And just as a reminder to those of you who don't practice dermatology, when we talk about otitis externa, it is inflammation of the vertical and the horizontal ear canal. And the dog's ear flap or pinna is usually involved with this disease as well, because ear inflammation and infection in dogs is usually an outside-in disease, not an inside-out disease. Usually starts with some pinnal involvement because of allergies, and then migrates its way down the vertical and the horizontal canal with inflammation, and then generally resulting in secondary infection, which we'll talk about. Obviously very common for the general practitioner. In some of the studies, up to 16.5% of the general canine population is actually involved. That number might actually be higher than that, because in some of those studies, they were relying on the owners to tell the veterinarian whether their dog had an ear problem without actually putting an otoscope down the ear canal to see if it was actually involved. And then some data that we have from the United States. Nationwide Insurance is the largest insurance carrier in the United States, and when we look at their claims for all of 2018, otitis externa was number 2 on the list of claims. So obviously something that general practitioners, first opinion veterinarians are seeing on a day in and day out basis. This is a slide that I spend a lot of time on when I do education for general practitioners in the United States, because I think these are the 3 keys to successful management. The first one is to obviously treat what you have before you. The patient that has inflammation and secondary infection and discomfort in their ear canal, obviously that has to be treated to have a happy pet and a happy owner. But it doesn't stop there, because this doesn't occur spontaneously. Ear inflammation and infections are generally due to another disease that initiates the process. And there's a whole long list of them that we talk to veterinarians about. But by far and away, the big 2 are 2 allergic diseases: food allergy and environmental allergies or atopic dermatitis. They account for about 80% of the dogs that we see. These are the primary diseases that initiate the inflammation and the infection in the ear canal. Now, the third one, which is not talked about as much as it should, once a dog has had a recurrent otitis problem, we shouldn't wait for it to flare up. You know, we treat a dog's ear, and if we don't do anything to it after that, it's prone to, after a period of weeks or months, flare up again. We try to get those dogs onto maintenance therapy using an antiseptic ear cleaner with steroids as needed to prevent the development of inflammation and infection, not to wait for it to occur. And even dogs that have a primary problem, like an allergy that we address, a lot of those dogs are still prone to develop recurrent inflammation and infections in their ear canal. Now, what we tell an owner is we might say to an owner, we'd like you to flush your dog's ear out with one of these cleaning solutions, probably every week or every 2 weeks to decrease frequency and severity of recurrence. All right? They might say, it's going to be a lot of work for me to do. So then we might explain to it in medical terms. It's medically better for your dog because then we're not as likely to get resistance developing, which is going to be harder to treat. And they might understand a little bit of that, but you know what they really understand? Cost. All right? And if a dog gets recurrent otitis 4 or 5 times a year, we say this is how much it costs you on an annual basis. If you're willing to do a little work once a week or every couple weeks, this is how much money you're going to save, and they really understand that, and they're willing to do it. So we can make a lot of strides by doing preventative maintenance in our patients that have this condition. Now, when we see inflammation, it's very common, as most of you know, to see secondary infection. By far and away, the 2 most common pathogens that we see in acute otitis cases are staph and malassezia. Staph being the number 1 bacteria, malassezia being the number 1 yeast. All right, and how often do we see those? Certainly in at least 50% of our cases, but if you look at the epidemiologic studies that have been done, as high as 70 to 90% of dogs that present to a first opinion veterinarian with acute otitis will have staph, malassezia, or the combination of the 2. This is what veterinarians are seeing on a day-to-day basis, multiple times when they have dogs that present with acute otitis externa. Really important, we'll talk about cytology in a minute, but very important that veterinarians are able to identify these organisms under the microscope, because it then helps them select the correct treatment. And we'll talk about that a little bit more in a few minutes here. Now, when we do cytology and we find that there's not spherical coccoid bacteria or the snowshoe-shaped malassezia yeast, but instead we see rods, now we have kind of a more difficult infection to deal with. But gram-negative infections with rods generally only occur in 3 to 5, maybe a maximum of 10% of acute otitis cases. When you have a dog with chronic recurrent otitis, that number goes up to more like 15 or 20%, may even be a little bit higher than that. But what first opinion veterinarians are seeing day in and day out for their acute cases, they're seeing staph and malassezia. But it's important for them to identify and differentiate because it's different forms of treatment. We spend a lot of time in the United States teaching our veterinarians to do good cytology. Over the 4 years that Claro, Neptra, has been available in the U.S., we had a major education campaign that we started. Jim Noxon, who some of you know is a dermatologist at Iowa State University, did a really nice webinar on cytology for teaching purposes. We had a lot of educational material on cytology. I manage our veterinary field team in the United States, and I taught all my veterinarians how to do proper cytology, and now they go to practices and they do 2-hour cytology wet labs for veterinary practices. The nurses are involved, the veterinarians are involved. We take it anywhere from how to collect samples to how to do staining to how to adjust your microscope to make sure it's in focus and centered and has the right lighting, and it's amazing. We've done now thousands of veterinary practices around the United States. They're better cytologists, therefore they do a better job with otitis and they select their treatments appropriately. So the whys of cytology are, why guess when it takes 10 minutes to do? And we say to veterinarians, you shouldn't be doing it. Your nurses should be doing it. They do a better job than you do once they're trained and once they're tested, and they actually like to do it. If you're a veterinarian, your 10 minutes should be better spent in the examination room with the client doing client education on otitis. All right? And if you learn how to do it, if your nurses do it right, then you're selecting the appropriate treatment the first time. Decreases the possibility that you're going to get poor response to therapy. We use it for monitoring success for therapy. Opportunity to get nurses involved. They love to do it. And if a clinic isn't doing cytology, and they start doing it and we teach them how, not only are they better from a medical standpoint as a veterinarian, but they're actually making some additional income. And the example that I use is you have a 2-veterinarian practice that isn't doing cytology and they start to do it. It's not unreasonable when you look at skin cytology and ear cytology to do, say, 5 a day. And if you charge a nominal fee of $25 to do it, by the end of the year, you've increased your practice income by over $30,000. So not only is it good medically, but it's good financially for practices that start doing it and haven't been doing it. So it makes a big difference, and we spend a lot of time doing this. Now, let's talk about some treatment challenges here. One of the challenges, as we already said, is not doing cytology. Another one is convincing veterinarians sometimes that the cleaner the ear canal to start with, the better off you are. The why here is the cleaner the ear canal, the better your topical medication works, because it can actually penetrate that vertical and the horizontal canal to get down and treat the infection. The other thing to remember is that some of the good antibiotics we use topically, like aminoglycosides and polymyxin, they are inactivated in organic debris. So if you have an ear full of exudate, blood, and pus, those antibiotics actually get inactivated. The other part of this is how. Not going into that today. That's a separate 1-hour lecture to do that. But the only thing I will mention that we don't actually clean a dog's ear canal when the dog is awake. All right, if we can clean it out when the dog's awake, we don't do any differently than it's done in general practice by putting the flushing solution down and massaging. The only 2 things that I will mention, some dogs that don't like flushing solution down their ear canal, another technique we use, rolled cotton, make it into a small cylinder, introduce it into the opening of the vertical canal, put our flushing solution directly on that so we're not squirting it right down the dog's ear, gently percolates down the ear, all right, so we get it treated, and then we're able to remove that cotton and get a lot of exudate out. The other thing that dogs don't like about having their ears flushed out, they generally will tolerate the liquid, they don't like the cold. All right, you're putting a room temperature cleaning solution down a warm body orifice, and they hate that. We always keep our cleaning solutions in a water bath at body temperature during office hours, and they might not like it, but they tolerate it a whole lot better than putting a cold cleaning solution down. And then how often? We have gotten to the point now where we do a whole lot less flushing than we used to do. We get ear canals clean, and then we flush them only as frequently as needed to actually keep the ear canal clean. We don't push it any more frequently than that because the wetter you keep the ear canal, the more you might macerate the tissue and actually invite the development of infection. And specifically with what I'm not going to go into, we have some overlap, but you have a different group of flushing solutions here in the UK than we have in the United States, and obviously you're all going to have your favorites. All right, so another one here, which veterinarians usually get, is we use a lot of steroids initially because of inflammation, pruritus, discomfort, and inflamed ear canals. What you're actually seeing on this list, this is some common corticosteroids that are found in commercial ear formulations in decreasing order of potency. All right, now a couple that you have available that I don't have on this slide, hydrocortisone acetonate would be somewhere in this range here as a pretty potent steroid up along with triamcinolone and betamethasone. Another one, prednisolone, would be down in the area where dexamethasone is. So here's the challenges we've been talking about: the need to do cytology for proper selection of medication, the need to start with a clean ear canal for maximum clinical response, the correct volume of medication to make sure we adequately treat the infection, and finally here, the fourth one that we haven't talked about is that we have for decades been treating ear infections with formulations that have aminoglycosides, fluoroquinolones, and polymyxin antibiotics. All right? We've had no other products available until recently. So through no fault of our own, we've essentially been completely over-treating run-of-the-mill, day in and day out, staph infections that come through our door. Aminoglycosides and fluoroquinolones are critically important antibiotics for resistant infections in companion animal medicine, for multiple organ systems. All right? They're really needed when we have difficult infections. On the World Health Organization list of human and veterinary antibiotics, fluoroquinolones, polymyxin, and aminoglycosides are at the top of the list of critically important antibiotics. In the United States, the AVMA guidelines for veterinarians is you should not be using these antibiotics unless you have a systemic infection, unless you have a culture and susceptibility to actually support their use. All right, so it's kind of like if you had a superficial pyoderma come into your practice for the first time with routine staff, would you run in the back and get a vial of gentamicin and start doing gentamicin injections in that dog? You would never do that, but that's essentially what we've been doing in ears. Again, through no fault of our own, because that's all we've had available. So these are the products that we've been using with things like aminoglycosides, fluoroquinolones, polymyxin B, all excellent antibiotics when they're absolutely needed when we have difficult gram-negative infections in the ear canal. Now, the other challenge that we've had with these really otherwise good medications, other than Ezodic, which is once a day for 5 consecutive days, all of these other products are once a day or twice a day application for 7 to 14 days or longer until the infection is actually brought under control. And that brings us to the ultimate issue, the ultimate treatment challenge that we have, and that is compliance issues. The number 1, number 2, and number 3 top challenges have always been compliance. So what ends up happening in many cases is you prescribe one of those antibiotics, and you tell the owner you want them to use it once a day or twice a day for 7 to 14 days, so they go home, and you also tell them, we want you to put 4 drops or 8 drops in your dog's ear. So they go home and they start trying to do that, and what do? Dog doesn't like it, they don't like it, they chase the dog around, they do it for 2 or 3 or 4 days, then what happens, they get tired of doing it, and after 2, 3, or 4 days, the ear actually looks better. But it hasn't been completely cured at that point, but it looks better to them because the steroid is controlling the inflammation. What they do in many cases is put it aside. And the next time the dog flares up, they don't come back in and see the veterinarian because they still have medication left, so they do it for another several days. And when they come back and see the veterinarian is when it's no longer working because now of inappropriate, intermittent, short-term antibiotic use, you've got a resistant gram-negative Pseudomonas infection in that ear, plus or minus otitis media. And by the way, when they come back in for that, they don't bring their bottle of medication because they still have some medication in that bottle that they actually should have used months ago. This has been the biggest challenge, which is why we see recurrence or we see recrudescence of infection. What is recrudescence? It means the infection was never gone to begin with. It looked like it was gone, but there was still infection in that dog's ear canal. So this slide here is interesting because anytime we talk to clients about trying to get them to do something, compliance type of issues, this is generally how the discussion goes. It goes up to the owner can't do it, and then we do more client education, and they get a little bit more engaged with it. And finally, they get up to the point where they decide, yeah, I can do that. And then you know what you do? You look them right in the eye, and you say, but will you do it? And if they look away, they're not doing it. All right, that's just kind of human nature. That's what we know from studies that have been done. So this is always the challenge to treatment success, especially when we're looking at something as challenging otitis. So how about this? I don't have to do it. All right, and that is the biggest benefit because if they don't have to do something, happy dog, happy owner, maintenance of the human-animal bond. All right, so that is why Bayer developed Neptra. We see a lot of otitis externa on a day-in and day-out basis. The owner has challenges with treatment compliance, but the veterinarian also gets frustrated, right? Because when the owner comes back and the ears know better if there's been recurrence, they don't blame themselves for compliance. They tend to blame the veterinarian that maybe you prescribed the wrong thing, when that wasn't the case. So you don't, not only have the owner frustrated, you have the veterinarian frustrated, and that's why Neptra was created. So The biggest positive amongst many positives associated with Neptra, this is the only product on the market for otitis externa that is one single treatment. The owner does nothing, and it's a single treatment. This guarantees compliance because the owner does absolutely nothing. It's obviously easy because of that, and it works for the overwhelming percentage of otitis externa cases that are seen day in and day out by the first opinion veterinarian. So, what is Neptra? Well, first of all, Neptra is approved for canine acute otitis externa and for acute exacerbations of recurrent otitis externa associated with staph pseudointermedius and Malassezia pachydermatis. That is how it is labeled. That is the approval. Now, how do we get there with one application? Many of you are already familiar with some of these ingredients, so I'll just touch on them briefly. It's 3 ingredients in combination that actually make a lot of sense. Florfenicol is the antibiotic. Great gram-positive spectrum, including for what it's indicated for and approved for, staph pseudointermedius, the #1 bacterial pathogen in the ear canal that is seen day in and day out. Florfenicol is a member of the chloramphenicol class of antibiotics, all right? But there's less resistance associated with it because it's not a substrate for chloramphenicol transacetalases. It is also safer than chloramphenicol because it's not associated with anemias or aplastic anemias. It is a total niche antibiotic only for use topically in the ear canal. It's very, very minimally used in companion animal medicine for other types of infections. So it has this specific niche for the ear canal. It's not on the World Health Organization list of critically important antibiotics. So it is the perfect narrow spectrum antibiotic for what's seen on a routine basis day in and day out. Terbinafine is the antifungal agent, very effective topically for a variety of fungal organisms, including Malassezia. It is not an azole antifungal agent. It still works by affecting ergosterol synthesis in the fungal cell wall. Interestingly, this is not a product, we have nothing that's actually approved for treating otitis media, but there's actually been some safety studies done with this where it's been put in the middle ears in the rat model with no problems with otitis media and ototoxicity being seen in that scenario. And then finally, the steroid that's in here is the potent one that we've already talked about, mometasone furoate. Now, the other thing that's cool about these ingredients, to one degree or another, they have pretty good lipophilicity. What does that mean? They penetrate lipids. And as we all know, when you have a dog with an infected ear canal with a lot of lipid, waxy exudate, the fact if you have an active ingredient that can get in that material and stay in that material actually leads to the residual activity that we see with this product that is associated with some of these active ingredients. All right, so let's talk about what we know. So there have been, actually when we count up the safety studies, the pilot field safety and efficacy studies, the studies that were done for approval, there's like 12 studies that have been done on this formulation during development. All right, and then the pivotal field safety and efficacy studies, we have a study in the US, a study in the EU, and actually a study in Japan. So there's really a lot of data associated with this product. So let's talk about the US study first. So in the US, we are required to do placebo-controlled studies. So we have to compare the product, the FDA requires comparing the product to a placebo control. So this was a multi-center study done in dogs that have otitis externa that were diagnosed by culture and susceptibility. That is what is required by the FDA in the United States. The 4 parameters that were evaluated are the 4 parameters that have been identified based upon the Otis 3 scoring system that Tim Nuttall developed. That is the study that most regulatory agencies actually use for drug approval. So these are the 4 clinical signs that are evaluated. These are client-owned dogs, obviously. diagnosis confirmed by examination and culture. They were evaluated out to 30 days, okay, in this study. Those 4 scores were given a score of 0 to 3, so the maximum score that a dog could have in their ear would be 12. Now, in the study that Tim did, he said if it's 4 or over, you have a significantly clinically affected ear. But what the FDA requires in the United States is a score of greater than or equal to 6 out of 12 for introduction into the study, so that's what was used. And also based upon Tim's study, you have an ear that goes back to normal or is resolved if the score is less than or equal to 3. So that is what was used in this study. Now, I'll tell you, it was even a little bit more stringent than that, because at day 30, for clinical success, the score had to be less than or equal to 3. But if any one of the individual parameters didn't improve, the dog had to be considered a treatment failure for statistical purposes. And at 7 days, if the score hadn't already improved by at least 2, the dog was also considered a failure for the study as well and was statistically evaluated as a failure. So how are these dogs treated? They come in with otitis externa, they get their ears cleaned. Under general anesthesia with a deep cleaning? Absolutely not. Have to do it in a real-world situation. Dogs had their ears cleaned out with saline. All right? Saline isn't a particularly good cleaner, but if you're going to get a product approved, you can't use anything that might have antiseptic activity, so cleaning just with saline. Then the ear canal gets dried out. How? Cotton on the end of a finger, down the ear canal. Real-world situation. Then 1 ml, full vial of the drug being put in the ear canal, massage the base of the ear for 30 seconds, let the dog go and run around. So real world situation, that's how the study was actually done. So what was found here? Here we go. So in the treatment group that was treated with Neptra at the 30-day evaluation, 72.5% of the dogs had treatment success, 11% of the dogs in the placebo group. So how good is 72.5%? It's outstanding, especially for a product, single-dose administration, because if you look at all the other products that you are currently using in practice, most of those are pretty much in the region of 60 to 70% efficacious with multiple dosing. So this being single dose with 72.5% is outstanding. And I'll tell you, it even gets more outstanding than that. Why? Because the FDA in the United States does not allow you to break your culture and sensitivity code until the study is over. And what was found when the code was broken? 11% of the dogs that were treated had Pseudomonas aeruginosa. That's not what the product is approved for. It's approved for staph and malassezia. So if you back those cases out of the analysis that had Pseudomonas and only include the ones with staph and malassezia, now that value is pushing 80%. So that is with single administration product, 1 application, 80% treatment success at the end of the dosing period at 30 days. All right, also well tolerated. All right, so adverse events were monitored, blood work, serum biochemistry, CBCs, urinalysis, hearing. What was found? Low number of adverse events, none related to the ear, and none considered serious, and none considered related to the drug itself. If we look at the blood work and the urine work, any changes that occurred in that work actually were within the normal reference range for the laboratory, so there was nothing out of the reference range when we looked at that work. So not only great efficacy, but also very, very well tolerated. So let's talk about the EU study now. Now, what's done in the EU, required by the EMA, different than in the United States, okay? Placebo-controlled studies generally are not done here unless there's no other option. So here, non-inferiority studies are done where the product is compared to something that is already on the market as a positive control. So the study here was done with Neptra, single dose, compared to Positex, all right, as labeled, 7 consecutive doses on a daily basis. Positex is really a pretty stout drug to compare to. It has a fluoroquinolone antibiotic in it. Also has mometasone, the same steroid that's in Neptra, and has a very effective antifungal agent in posaconazole. So that was the comparison that was made. Again, client-owned dogs, this time out to day 28, this time using the same scoring system. But in the EU, the cutoff that the EMA wants is greater than equal to 5 out of 12. In the US, it's greater than equal to 6 out of 12. But I will tell you all that it's greater than equal to 5 out of 12. The mean scores for the dogs at entry into this study were above 7. All right? And then treatment success, the same thing, less than or equal to 3 out of 12 at day 28 in this particular study. All right? So what was found? Here's the data. Top line there, percent clinical success. Percent of dogs less than or equal to 3 out of 12, 87.4% for a single dose in the 135 dogs that were treated with Neptra. For Posatex, 127 dogs treated 7 times, once a day, 79.5%. Statistically, there's no difference between these figures. Non-inferiority was shown, so equal efficacy, single-dose Neptra versus 7 consecutive days of Posatex. Now, in this study, that was interested in looking at relapse rates, all right, as an indication of, well, could there be any resistance or anything developing during the course of treatment? So if a dog went to less than 3, but then spiked up again, that was considered a dog that had relapsed, very low relapse rates. And in the European study, there was also a global score, a 5-point global score, anywhere from very poor response to excellent response that the investigators did at the end of the study. 75.5% for Neptra, 60.6% for a good to excellent response. All right, now let's look at this same data, but graphed out. So this is exactly the same thing. Again, no statistical difference between the two products. The reason why I want to show you this in graphical form, because if you read the SPC for this particular product, which you'll have the opportunity to do, it says in there that maximum clinical response might not be seen until day 28. So you look at that, and that's true. Maximum clinical response of 87.4% was seen at the endpoint of day 28, but what I want to show you is out to 7 to 14 days, you're already seeing a really dramatic response with this drug. You get continual improvement between the day 14 and day 28 period of time. There's no fall off in efficacy rate and success rate between day 14 and day 28. The other thing that's actually seen here is that if you follow out cytology, cytology numbers fall off precipitously at the 7 to 14 day range, and then they continue to improve. And the reason why I bring that up is because in many cases, veterinarians will want to do a recheck at 2 weeks in their patients with otitis externa. Based upon this information and our experience with the drug over 4 years in the United States, now rechecks are often not done until 3 weeks after initiating treatment, because we know we're going to see a continual response and see continual improvement in cytology out to that time point. So our approach is a little bit different at the specialist and the general practitioner level. We might not do a 2-week recheck just because of this data. We'll go out to like about 3 weeks. All right, so that's the data that we have now. The EMA did not require blood work or urine to be done in the European study. Why? There was already also so much safety data that had been generated from the target animal safety studies and the efficacy study done in the United States where blood work was looked at, that it wasn't required. Simply adverse events were looked at in this scenario. There were only 5 adverse events in each group, none related to the ears, and none were considered related to the medication. Now, I will tell you this. When you read the SPC, all right, you will see a list of additional adverse events that have been seen. Those were not done in the studies that we're talking about today. Those are in there now because we have 4 years of pharmacovigilance data in the United States with 5 million doses of the medication being used. And so now the SPC has some information on there on other things that you might expect to see associated with it. Everything that you see actually listed in there goes under the lowest category of being very rare, which means less than 1 in every 10,000 cases treated. I think the most important thing from our experience in the United States has been veterinarians simply and their nurses wash their hands after application. So that's another thing that you will see in there, and that's based upon our pharmacovigilance data in the United States with the 5 million doses that have been actually dispensed. So 2 things that I want to make you aware of. So everything that we've talked about here, and I'm not going to show you the Japanese study results, which are similar to the European study results, address the challenges that we talked about. All right, challenges: compliance, convenience, and control. Approved, single dose, 28-day duration for the most common causes associated with otitis externa that first opinion veterinarians are seeing on a day in and day out basis. Single dose, that takes care of compliance. Spectrum of activity associated with the 4 active ingredients that we talked about, with florfenicol being an excellent niche antibiotic for treating staph infections, and then volume. Each one of these vials is 1 ml. It is 1 ml per ear. And I will tell you, in the United States studies that were done, dogs were successfully treated anywhere from 2 kilograms to 55 kilograms of body weight over that entire weight range. So it does a great job over the whole range of different sized dogs with different volumes of ear canals that we see. And one of the things that we really liked when this product came on the market in the United States 4 years ago, it's not a gel, it's not an ointment, it's a clear liquid solution. And nothing penetrates a stenotic, narrow, swollen ear canal better than a clear liquid solution to get our medication down that vertical canal and down to the horizontal ear canal. And so a lot of things to like about this product. Another thing at the general practitioner level and the specialist level, easy to inventory because it's room temperature storage. Doesn't have to go in the refrigerator. You have a case that comes in. You don't have to get it out of the refrigerator and warm it up before you put it in the dog's ear. Totally room temperature storage for long term. So let's talk about some other comparisons here. We talked about the European study, non-inferiority study between Neptra and Positex. How about some other products that we use? Now, these are not head-to-head single studies, but these are the 2 separate, pivotal safety and efficacy studies that were done in the United States. In this looking at this, we can compare data for Neptra to Ezotic. Neptra, single dose, Ezotic, 5 consecutive doses. Using the same clinical scoring system, 72.5% treatment success for Neptra, and the separate study with Ezotic, 68.5%. Again, we're seeing equal clinical efficacy with a single dose product versus one that's given for 5 consecutive days. All right. How about Externa? All right, so Externa actually came on the market in the United States 6 months before Neptra came on the market. And this product was really well received because of its indications. Same indication for both of these drugs. All right, the big difference being Neptra, single dose. Externa requires 2 doses, so a second application after 7 days. All right, and you cannot cheat and not give the second application. The owner has to come back and remember to come back and have that second application. So why might that be with similarities between these products? We don't know the whole story, but this could explain some of it. They both have florfenicol, but the amount of florfenicol in Neptra is 67% higher. Both have terbinafine, but the amount of terbinafine is 48% higher. They both have a steroid, but mometasone is a more potent steroid by 7 times versus betamethasone in the head-to-head studies that have been done. They're both 1 ml. One is a clear liquid solution. The other is a translucent gel. More on that in a minute. Room temperature storage, refrigeration storage is required for Externa. And for both of these products, after initial application, the recommendation is to not reflush ears for 28 days to get maximum residual activity. All right? That single dose and the comparable efficacy and these differences in the formulation probably account for why, although Externa was on the market and very well received 6 months before Neptra came on the market, all right, Neptra overtook externa in sales and actually has overtaken every other product that is sold for otitis externa in the United States. And now, as I said, has a 44% market share, 5 million doses having been dispensed, and is the #1 selling otitis externa product in the United States. And that's probably for all the reasons that we just talked about. So to finish up here, the real value, the real beauty of Neptra, first-line treatment for the 70 to 90% of what a first opinion veterinarian is going to see on a day in and day out basis. Single treatment, they have control, compliance, convenience, the owner does nothing. Obviously, the owners love that. Important to differentiate and choose your cases, staph and malassezia. And that's why we like to train veterinarians on how to do cytology so they don't use this medication inappropriately. When we have cases that rods are found on cytology, such as in these difficult recurrent ears, Neptra is definitely not your choice. All right? That is when now we have the medications that we were previously too commonly overusing for run-of-the-mill staph, so that when we ran into a problem then with a difficult gram-negative infection, we didn't have a lot of options. Now, we have a lot of options available when we do see gram-negative infections like Pseudomonas, because we haven't overutilized these antibiotics for the run-of-the-mill, day in and day out staph infections that we see. Now, a couple of final things here. Like I said, we have a lot of experience with Neptra, over 4 years and 5 million doses. Couple of things here. We really stress, as we've said, case selection based upon cytology. All right? We don't want veterinarians to be reserving this drug for their most difficult cases. All right? Human nature, new drug comes on the market. What do veterinarians think? It's a new drug. It must be for really bad cases, so I'm going to wait and not use this drug until I get my most difficult recurrent otitis in, usually which is Pseudomonas with otitis media. That's what I'm going to reserve it for. We tell them, you're going to be really disappointed if you do that. That is not the whole point of this drug. Start with a clean ear canal, and that is getting that ear canal cleaned by, you can use saline, but what most veterinarians do in the United States now, they're using what their favorite cleaning, flushing solutions are to get these ears as clean as possible, because saline isn't going to do a great job in a lot of ears that have a lot of exudae. So a lot of different flushing solutions are actually being used prior to the application. Now, I put this on here, apply in lateral recumbency if so desired. Why do I put that here? Because the SPC says apply, massage base of the ear for 30 seconds, restrain the dog's head for 2 minutes. It's not how the studies were done, but that's what it says in the SPC. So my point is that it's really hard to restrain a dog when they're standing there in front of you for 2 minutes after you've applied something to the ear. Heck of a lot easier, just put the dog in lateral recumbency, lift the pinna, put it in the vertical canal, massage. A lot easier to keep the dog restrained in that manner, and you're getting great penetration down into that horizontal canal because the dog is laying there, then flip it over and do the other side. And that's what we recommend to veterinarians in the United States who are doing it. We already talked about time to reschedule a visit. Recheck expectations. This is part of our discussion on cytology. Veterinarians sometimes think that a cured ear canal means it's sterile, that there's nothing left in it, that there's not going to be an occasional yeast or an occasional bacteria as part of the normal microflora, and we know that it is. So we teach them to kind of look at the ear canal, look at clinical success, and on your follow-up cytology, if you have a normal ear but you see an occasional yeast or bacteria, that is an ear that has responded normally. You're not going to see sterile ears in most cases. Not for your most difficult cases, and obviously, nothing is going to work long-term if a dog has recurrent otitis and you don't look for primary causes. So, in summary here, Neptra, first line, single application, complete compliance and convenience, complete control by the veterinarian for the 2 most common pathogens that we see, get the ear canal cleaned out, and then use something like Neptra that's a combination but no owner involvement. Active ingredients make most sense for the common pathogens. delivers an effective volume, and has 28 days of residual activity. Thank you.